Now, young single people in Ghana are more likely to be involved in motor accidents. This is according to medical officer and researcher with the Accident and Emergency Unit at the KBTH Hospital, Dr. Abigail Mana. She says data shows individuals within the youthful age bracket tend to drive recklessly. She was speaking at a town hall meeting dubbed Operation Stay Alive, where she advised commercial drivers and motorists to drive safely. Lois Stay has more in the following report.
Dr. Abigail Mana, who works as a medical officer at the Accident Unit of the KBTH Hospital, says more than 70% of victims involved in accidents and brought to her unit were young and single. She also observed that many of them were drivers and motorists who drove recklessly. She spoke at a town hall meeting with commercial motor riders.
From 18 to 35 found the majority of the cases, which form like 75% of the cases. And the singles also find out most of our majority of cases that I saw. Okay, so most men may not marry early and they might be involved. And you know, when you are single, you just want to live life, you want to be happy and all that. So they live, I'm not saying recklessly, but some of them do the reckless driving around. So I think that's what is causing them having a higher incident rate of the accident they are having.
Dr. Mana said many of the victims didn't know much about road signs and traffic regulations. She advised them to wear helmets always to minimize the impact of accidents.
And my major findings were those who came in with helmets has a tendency of reducing head injury and fatal accidents. I had only 7% who had idea of our road regulations. Some cannot even identify any of the road signs. So my advice to our motor riders is we want them alive. We want them to stay alive. So we want them to please use their helmets, which will help us to reduce the head injury cases, and we want them to obey the rules and road regulations.
Speaking on the side of the event, National Chairman of the Okada Riders Association, Mohammed Tinjani, implored the government to legalize commercial motor riding in the country as it is a source of income for many young men. He also pleaded with restaurant owners to hire trained and licensed motorists as dispatch riders.
We are pleading to them to listen to us, to legalize the Okada for us, because now everywhere I choke. Only this job have the population in Ghana now. But by all means, if they legalize the Okada for us, we follow the law and regulation. And we are pleading to the people who, especially restaurants, we are pleading to them, if they want to take a dispatch rider, they should go to the correct channel and follow the correct way. They should come direct to us. We will show them and we will give them the correct people who could feel right.
It is expected that this sensitization will be effective in curbing the high occurrence of motor accidents, especially during this festive season. Lois Tez reports, read to you.
Now let's stay a little longer on this story and speak to the National Road Safety Authority. The Director of Planning and Programs at the National Road Safety Authority, Engineer David Adonting, joins us live with more. Now, does this observation reflect in the data you collect on the ground as well?
And thank you very much for this opportunity. Yes, indeed, yesterday we organized a town hall meeting for motor riders, and we had a couple of unions and associations joining us, so we could share ideas on the relevance of adhering to safety rules and regulations and standards. I think the discussion was very fruitful, and what it meant is what we are raising now, because we had a whole representative from the teaching hospital, Kolebu, injury department, revealing some research findings that included a number of issues that otherwise had not been even been focused on for a number of years now. For example, talking about the age level, the age bracket, riding motorcycles and having...
We'll come to that, but I'm just trying to find out from you whether what she put out correspond to what you do have in terms of the data you collect as well.
Our data has all these revelations are well entrenched in our data. A couple of times we have come out in the public space to raise these matters, and so we were not surprised that because everything we put out there in our kind of communication on those city matters are data-led. And we get a data from the Building and Road Research Institute, we get a data from the police, and then from the hospital. So indeed, it is a clear reflection of what we see on the ground.
Okay, let's now talk about the factors that are leading to what we are observing, what you're also alluding to now. What have you found?
Indeed, in their revelation, just as we also have, we see that riding motorcycles in Ghana is a risky venture. Risky because the riders and the African riders are not protected in a manner that can save them when they fall victim to road traffic crash. Again, it also talk about in terms of wearing of helmets. Most of the injuries they record there appear to be head injuries and then broken limbs, which clearly shows that most of them are not wearing the helmet and they are not also wearing the gears in terms of the protective gears. They also spoke about some of them drinking, taking drugs, and riding. And other groups also kind of not respecting the rules and regulations in the road space, especially at intersections. And talking about the age level, the bracket where you find the youth mainly between 18 and 24, 25, mostly getting involved in these crashes. And they attribute it to the fact that they are young, they are not responsible. Most of them are not even married. And so the research recommendation has direct to the fact that if you are young, youthful, exuberant, your will and behavior, you are not responsible for any child, and so you do things in your own way, the way you see life and the way you enjoy life. I think that these are very clear revelations, and a couple of years when we started discussing this Okada menace, all these issues came up. So it came as a confirmation of what we already have. And I think it's very good for all of us.
So once we know the factor that are contributing to this, the rise in what we're seeing, what is the National Road Safety Authority doing to reduce their numbers this Yuletide?
I think that much as we want to step up our education, I'm sure it goes beyond education. It's a matter of now having a targeted education. The revelations are there, clearly defining that there's a particular age bracket that must be focused on. And so we will redirect our education not to the entire motorcycle riding, but we will try to focus more on this age bracket and also further see how the police can stamp down their authority on this group of people. We will not say that we will encourage them to go and be responsible by marriage. I think that there was one particular discussion where we see that those who are married must be responsible, and perhaps they are the ones that should be allowed to ride motorbike. I don't think, but that's a social discussion.
Okay.
But technically, we are going to make sure that they are licensed, they have gone through training, they have been given proper conscientization as to how to ride motorbike safely within our road space, and we will continue to engage them periodically through sensitization, and then let the police also do their work in terms of enforcement. I think these are the key things we'll be doing from now. I'm
grateful. David Adontenye is the Director of Planning and Programs at the National Road Safety Authority.
Thank you very much.